Well, thank you to both Amy and Adam. It's really informative. So my name is Samantha, and I am with Connect Your Community. I was the assistant director of the original project. I'm now the research director of Connect Your Community Institute, soon to come. And I'm going to talk a little bit about the digital divide. And give you a little bit more background about what these things are that are impacting access to health records. So according to the national data, let's start with the overall big picture. In the 2015 American Community Survey, this is pretty much the most current national federal data that exists. Okay? So 76% of all US citizens have a broadband internet connection. Now that's full. That means basically a quarter, every fourth person does not. Right? So at first we think that sounds like a pretty high percentage, but we realize that this means tens and thousands of people that are going without any kind of access. And 4% rely actually on dial-up still. I don't know about you, but I didn't even think dial-up still existed, right? So we kind of have our meaningful use, this like our four-legged stool here. The biggest barriers to getting connection is cost. It is availability, digital literacy, and then the hardware and kind of technical support aspect, right? So let's look at the local problem. We're here in Cleveland. We all care about Cleveland. Let's see what's going on here. Here's the same federal numbers, but just for the city, okay? So basically, 31%. So originally we said, about 24% nationally. We're way ahead in those that are unconnected. So you see where we stand against the national average. And poverty plays a big role, right? Those of you who serve in a lot of the city health systems, we know that we serve, a lot of low-income patients. And so this is hitting really at the heart of our patient population here in Cleveland. So those making, these are household figures, by the way. So this is not just a single income. This is for the household. Though a household making under $35,000 basically is only 58%. So that means that 79% here, let me see, have that right, have no internet. Almost 79, it's 78.3, you can see. That's a huge number. So availability is part of the problem here, right? So availability, if you can see this red area, all right, this is the area where less than 40% have access to 3 megabits per second download speeds or better. Now, I don't know how many of you guys, what speeds do you have? I can say that I have kind of a middle-of-the-road speed, and I get 30, right, in my home. And I still complain that my videos don't load and they buffer and, sputter at some times of the day. So imagine 3 megabits per second. It's very, very prohibitive, very hard to run a lot of media, rich or intensive applications with that speed in this day and age. And these areas don't even have access to better. This is a major problem here. You can see it's pretty much the entire east side of the city. Okay. So here is, this is by census blocks. Okay, so it breaks it down a little bit, and this is the maximum. This one shows the red parts are a maximum of, the darkest red, it only gets dial-up. It's basically 768 kilobytes per second. The orange parts are only getting 1.5 megabits per second, and the red, if you can see the kind of medium red color, has a maximum speed of 3 down. So before I showed you that was areas 40% of lower of those areas. This is actually by census block. These are streets and neighborhoods here. So what have we done about this problem? Clearly it's been going on for a while. Before 2010, basically we had dozens of greater community technology centers, libraries, community college programs, we all collaborating to provide kind of a basic level of computer training and connect people to available resources to get them online trained and help with some of those barriers. Clearly, we weren't able to affect the prices of telecoms, but we did have some access, things like the Lifeline program for the last couple years has been able to get people about 10 megabits per second for $10 a month for those who qualify. It's in the income guideline. That is in jeopardy now with the new administration. There's been talk of rolling that back, so we're kind of in a wait-and-see position right now. So that's where we were in 2010. And then from 2010 to 2013, we had the Connect Your Community project. Some of you might have been familiar with the Stimulus Care project, the Obama stimulus plan. He actually gave, I don't have my notes up there, but I believe it was $240 billion? Yeah, $240 million across the country to the BTOP program, which is the Broadband Technology Investment Program. And that was a program of the NTIA, okay, the National Telecommunications. So in that time, that was for the entire country, so $240 million was spread out across the country, and we had one community was the servicing organization, and we were granted $19 million to run Connect Your Community. $5 million of that was spent here in Cleveland in Northeast Ohio. And with that, we trained over 8,000 people in the city in this time frame, in just under 3 years, really. And we created 5,500 new subscribers and connectors. These are people that had never before had a computer and internet in their home. So these are people directly laying in the digital divide here in Cleveland. We closed that for 5,500 people here. And that's what it looks like. So if you want to look at a visual, these are basically the addresses of all the people that we trained here in Cleveland between 2010 and 2013. It's huge. And if you notice, if you think back to a previous slide or two behind, we had that area that's the whole east side of Cleveland that has very little access. Notice how many that we trained in that area, right? So big impact. So we did 2012, we did a lot of studies. I ran the data collection program for that project, and we did a lot of looking into how that affected people. We don't have time today to go into all of the amazing impacts, but there were a lot as far as workforce, as you said before, how absolutely it impacts people's ability to get jobs, get a new jobs, have all of that stuff. And yes, that does somewhat inform our ability, when we raise our economic potential, then we also raise our access to other resources, kind of along Adam's idea with the disparities. We reduce those disparities just from having the financial equity to access them. So there's a lot of different impacts, but here's just some health-related insights. At the time, we basically asked, people went through a training program. It was about 30 hours of training, okay? It varied by center. Some people did it in a week, some people did it in a month. And what we did is we called them about 6 months out from conducting that, getting online, and then we called them 6 months later saying, okay, how's that working for you? What are you finding the benefit for? Tell us a little bit about your experience here. And 81% of all of our survey respondents said that the CYC improved their ability to find health information online. So basic technology literacy, one of the biggest things, the first things people do is like, oh my gosh, I want to look up my health. Do I need to see a doctor? It helps with that kind of decision-making process as to whether or not they need to seek more advice. It might, a lot of people did dietary information, just overall wellness. 29% reported using their broadband connection to communicate with their hospital and doctors. Now, this is in 2012, so clearly that's not that far ago, but I want to say that was pretty new. We were pretty impressed to see how many people, that 29, almost 30%, went out and started communicating with doctors. So very, very encouraging. 55% said that they felt more socially connected to their family. Now, a lot of times, you know, in health research, I don't know if they talk about the social factors of internet connection, but I will tell you that we served a lot of seniors. And certainly the Ashbury Senior Computer Community Center serves a lot of that population. And we talk to a lot of our seniors, and a lot of them have low mobility, they don't drive, or they're in homes, they have health conditions that don't let them get out as much, family that lives elsewhere in the country, so they're very socially isolated. And the internet connection really helped people to feel more connected. And to feel a little less alone. So it really helped with the mental aspect of our population as well. And so kind of along the same lines, almost 60% said that it made them feel more independent in general. So we could go into, there's so much more where that came from, and floating around, I believe there is a sheet, I don't know, over where? Over here, that actually has links to the information. So if you'd like a copy that has some of these links available on it, so you can kind of look through the full data set yourself, by all means grab it and you know, take it with you. But this is kind of where a lot of the information first came from, the American Community Survey, the FCC Form 477. This stuff is open source. You guys can log on, filter by your place, by census block, and by all kinds of different demographic information, income, race, you know, household size, education level. It's all there for you guys to manipulate. It's fairly user-friendly. And I just wanted to kind of give a little bit of plug to the local broadband and technology advocacy resources. There are a lot here in Cleveland. We are all a good, tight-knit community, and we all work together to try to help this situation. We're going to hear from Leon to talk a little bit about how his vision is going to be to pull some of that together. Also, we have the libraries do technology classes, both at the county and the public city libraries. Ashbury, that was talked about earlier. CYC, we're here still doing research, and Digital C, who I believe was also presenting today, is here doing programs to help close the divide here in Cleveland. So thank you very much. If you have any other questions, feel free to ask me.